Oral pathology refers to diseases that can develop inside your mouth, your salivary glands, or jaws. Although the majority of oral pathologies are benign, it is always important to get proper evaluation and treatment of any oral lesion or tumor by an expert. If you notice a bump, a lesion, or experience soreness in your mouth or jaws that does not go away or worsens over time, it is important to have an expert evaluation. Even if an oral lesion or tumor is not painful, it should still be evaluated and properly treated.
When you need an oral pathology screening, an oral and maxillofacial surgeon is the most qualified medical provider to diagnose and treat the condition. We have an in-office 3D scanner to better visualize bony lesions, pathologies, and tumors. In some cases, a biopsy will be recommended. We will carefully review your lab results and scans. If necessary, a follow-up appointment will be scheduled. We will fully discuss our findings and create a personalized treatment plan for the restoration of your oral health.